Good evening, everybody, and thank you for having me here. Were you aware that 1 in 2 men in this room will be diagnosed with cancer before the age of 85? 1 in 3 women likewise. 1 in 2 people, I'm trying to sober you up after the glasses of champagne. 1 in 2 people in this room will be needing treatment for a mental health illness at some stage in their adult lives. Now, if those stats aren't sobering enough, the leading cause of death for Australians between the ages of 15 and 44 is suicide, a damning indictment on how health is unconnected and could do with a lot of improvement. Now, the big problem that we're aiming to solve with Episoft is the growing prevalence of chronic disease. This was recognised by our employers Merck over 10 years ago, and my co-founder and I, Michael, were engaged in developing technologies that could improve the delivery of healthcare and reduce that big burden for taxpayers that's ever growing. And so Merck recognised that, and so we were charged with commissioning and designing new technologies, some of which are now leading technologies in the field, but the biggest idea that we had was Episoft. So the biggest idea was a cloud-based platform that could bring both healthcare treatment for chronic disease as well as clinical research into the one platform. This was too big an idea for Merck. Internet was in its nascency at that time, so Michael and I left and formed Episoft. It took us a few years to get the funding together to start this big idea. The seed funding came from the pharmaceutical industry. So let's talk you through a journey of a patient undergoing cancer treatment as an example. So the patient sees the doctor in their rooms and they talk to the receptionist about a booking, and that's all tickety-boo so far. So pretty clean, same system. Here's where it gets hard. The patient might be eligible for a clinical trial. So the doctor needs to talk to the trial coordinator, usually in a hospital. That involves numerous phone calls and faxes. Then the booking needs to occur for the patient undergoing chemotherapy, so the receptionist in both areas needs to coordinate that time. Doctor needs to send a referral to the hospital. The pharmacist then gets involved in ordering high-cost specialised drugs for that patient that are actually developed exactly for that patient and for their weight-based dosing. The pharmacist might need a Medicare script from the doctor, so a number of phone calls going on here and walking between different departments and over to the doctor's clinic. So then the nurse gets involved. The nurse has to deliver treatment on the day, and then if the patient's test results are not conducive to the patient having the treatment, then they have to have a conversation with the doctor. So all of that is quite hodgepodge, multiple faxes, multiple phone calls, but most importantly, transcription errors that could occur between piece of paper 1, piece of paper 2, piece of paper 3, and piece of paper 4. So inefficient and clinical risk. So that's the problem for cancer treatment. Now, when you look at mental health, the number of lines on that diagram would just be massive, and the number of people in that plan wouldn't even fit on a slide, so forget it, it's a mess. So in contrast, Episoft brings the patient into the centre of a cloud-based platform, and all the players are involved in the same care. They can see the same page about the patient, test results, prescriptions, documents, medical record, note-taking, everything. So that's Episoft. And I mention cancer and mental health specifically because we have traction in those major chronic disease markets, as well as others that are smaller, including Crohn's disease, a debilitating illness, hepatitis, alcohol and drug disorders. So we're B2B predominantly, but we also have an award-winning B2C platform, which is e-admissions, which connects the patient electronically with the hospital and delivers all the data into the patient's system, and we're online with 59 hospitals. And we've got at least 15 that are currently undergoing contract negotiation for that technology. So let's look at the size of the addressable market. Our marketing focus is cancer, but as I mentioned, we have capability in the other chronic diseases and traction. Now, medical oncology software is worth about $1.9 billion globally, and it's growing at a rate of 6%. That's the number of chemotherapy treatments that are being added to the care of people across the world nationally. When you look at chronic disease management more broadly, it's growing at $7 billion and it's growing at a rate of 17%, so much more significant growth. Australia's 2% of the global market. So in terms of traction, we've grown rapidly. As I said, we had a minimum viable product some years ago, but we've grown significantly since 2014. So in terms of revenue, $720K in 2014, $1 million in 2016, and it's important to note that it's all bootstrapped, so we haven't had a single ounce of funding from any investor so far, so that's customer cash flow. The record growth is phenomenal, so we had 7,000 records for Crohn's disease in 2014. We now have over 600,000 patient records in our cloud platform. That doesn't include a couple of network versions of our system running in hospital networks. Now, the other important thing is the deal size average. So $45,000 was our average deal in 2014. 2016, $500,000 is the average deal that's in our pipeline. That's the value of the deal. And we've also grown our recurrent revenue. So we had 45% was recurrent last year with $1 million. This year it's tracking at 65% of total revenue. So there's some of our blue chip customers on that slide. So the competitive landscape, focusing again on cancer, our marketing focus. So Episoft stands out in a couple of areas because we can do multiple chronic diseases. That's a key area. We can also do admissions and billing, which few of our competitors locally, actually none of our competitors locally can do. And we're cloud-based, so that's significant as well. But also importantly, we support cancer screening and surveillance in the same platform, reduce view of the workflow, just to manage patients who may be at risk of cancer. So we're in the business of stopping people getting sick, as well as helping them be treated more effectively when they are. Financial forecasts, $1.7 million will get acquired by the end of 2017 and 3.7 in 2018. Now we'll bootstrap our way to 1.7 without any headache, but to get to 3.7 we do need some investment and some sales animals in the team. And we're planning to go into animals, yeah, we like those, and we're planning to go into other markets. We're already in Asia in a little way, we're already in the US, we've got compliance for the US regulations and launched our last US site last year, but grow the market. Team, Michael is in the audience, he's my co-founder, and we also have Sally in the audience, our cancer applications specialist. You heard about me before. Michael's got a similar background, 20 years in health IT, an outstanding mind. We just connect, we work really well together. He's Brisbane based and he's a proven e-health thought leader and also an industry leader. He was on the board of the peak professional body for some years. Sally, our cancer application specialist, is here tonight, so she's in the audience. Aoife's away trying to sell more product, and Gavin's our CTO, and Pachin is our staff morale officer, and he reports to Aoife. Now, what I didn't mention is we have a great advisory board, and John Dennett's representing our ad board, very experienced people with lots of connections, so they have been wonderful advocates for Episoft over the time. But what we're after is some more great connections from the people in the room, and specifically introductions to people in state health. We don't have a lot of connections into the public health sector. Anyone that's a nurse unit manager in cancer, a CIO of a hospital, a CEO of a smaller hospital. Big hospital CEOs won't want to talk to us, let me assure you. Also, we're looking for some advisory board positions in gaps where we have, which is finance and marketing. But specifically, we're very undercapitalised, chronically undercapitalised. So we are looking for networks in the investment community. And thank you to Heads Over Heels for the opportunity, and to Gilbert and Tobin for a lovely venue for tonight. Thank you.